Morning, everyone. Please have a seat. As you can tell from the mustache behind me and the writing on the screen, this year we're focusing on Men's Health Month at this time of year in November. So last year, and we're trying to alternate it, so last year we had a Women's Health Month with presentations. Okay, this year we're doing Men's Health Month and presentations just to add a bit of variety, so it's not necessarily the same thing every year. And on that note, I know that we might be a bit pressed for time to run through things today, so I'm actually going to just pass over immediately. I think, Mr. Amelia, you're going to come up first for a bit of an introduction. Okay, and yeah, thank you. I'll pass over.
Good morning. As a part of Men's Health Month, we're going to explore today some really important aspects of men's health that are fairly challenging, but for kind of unusual reasons. It's because they often deal with aspects of men's health that can be embarrassing to discuss or shameful to discuss for a lot of young men and young adult men as well. So that doesn't need to be the case. We want to demystify some of that stuff today. So for instance, I'll talk about the fact that cardiovascular health is a really significant male health factor. But that's not something I'm going to spend time talking about, because if somebody has like a heart condition, there's no shame or anything surrounding a discussion about that concern. So we're going to spend our time on some other aspects. One of the things we're going to talk about is suicide. That is a tough topic to discuss. Some of you may have been affected by that. And if you are, we want you to take care of yourself, however that looks. And if you find yourself feeling stirred up, please speak to a friend or an adult. And if you need to leave, we invite you to return at any time. So there are three aspects. We're going to talk about physical, we're going to talk about emotional, and then briefly we're going to talk about the man box, which kind of has a little bit to do with last week's topic, that idea about like traditional concepts of what it is to be a man and how that actually leads to difficulties in the discussions around men's health. So physical health. We know, for instance, that physical health is really well understood. Historically, medicine has been established and studied by men. So we know quite a bit about men's health. And I'll give you an example why I bring that up. Recently, it's become very clear that symptoms of a heart attack in a female do not match those of a male. So that's an example of like, we know for men's heart attacks, and this isn't always the case, there can be exceptions, but for the most part, it's like tight chest, numbness in the arm, maybe tingling in both fingers. It can be bilateral or just the left side. Pretty typical. Women's symptoms can be like indigestion, heartburn, lower back pain. So they would go into a doctor's office and say, these are my concerns. And the doctors would be like, sounds like you need an antacid, or maybe lie down because your back hurts, right? No, they were having a heart attack. So men's health issues are understood fairly well, which also makes it ironic that a couple of things we're going to talk about today are still taboo to be discussed. And mental health issues are not as understood as well, but physical ones are. So here's a list of some of the major health concerns. Okay, cardiovascular disease, diabetes, strokes, liver disease, cancer. Some of these are on a list for women as well. But what do you think puts something on this list? What qualifies something as a health concern and maybe more focused on men and not necessarily women? What do you think is like a measurable analytic or metric of something that should be a concerning mental health issue? How about something that leads to death? I would say that's a health issue, right? So that's one that's easy to measure. So cardiovascular disease, cancer. Now on this list, which one do you think is the leading cause, and this is updated as of last night, I was checking the stats to make sure, from 2018 to 2022, according to StatsCan. Which one of those things do you think is the leading cause of death for men aged 20 to 29? Shout it out.
Unintentional injuries.
Yeah. Accidents, unintentional injuries. And not by a little bit, by like 3 times second place. Like it is way out in front. Men and boys do some very questionable things that lead to catastrophic and sometimes terminal accidents. Even men my age, what's the most frequent reason people are in the emergency room? Yeah, falling off a ladder because I was cleaning the gutter or something like that. Or maybe making a questionable rig to make it to the top of my very steep roof. Something like that. Okay, now what's number 2 on this list? Shout it out. What do you think is number 2? Depression. Depression is number 2. And if you go down that path, what does depression lead to? It's usually a result of suicide. Okay, so that's number 2. Number 3? Cancer. Good call. Well done, Finn. And number 4, we'll go one more. Now it's cardiovascular disease. Now you get to the one that people might think is most common. Okay. Now the cancers we're going to talk about, because most of them are very preventative. So prostate cancer. All right, something I like to do in my medical sciences class. Everybody point to your prostate. Yeah, there you go. I can hear some people like, wait a minute, I'm pretty sure I don't have one. The boys in the room should be pointing maybe below the belly button, like the belt buckle, and kind of deep inside, about 3-4 inches. So your prostate exists right at the bottom of your bladder. And your prostate has a role in your sexual reproduction system. What it does is contribute to the seminal fluid so that the ejaculate is going to be most successful in fertilizing an egg. Without your prostate, you wouldn't be very successful reproducing. So it sits right there, and that tube going down the middle is your urethra. So the top thing is the bladder, collects the pee from the kidneys, and then when you need to pee, you're like, oh, I gotta pee, and then you release a muscle, little sphincter right at the top there, you relax and you pee. And it goes right through the prostate. One of the symptoms of prostate cancer later is difficulty peeing, because as it enlarges, you can see it's constricting that vessel, so your urethra can't release the urine. So you dribble, and then you don't feel sad, and you go back to bed, and like old men often up many times in the middle of the night. Now, prostate cancer is a concern for older men, but it's something we need to destigmatize and realize that the chances are you are going to get it. There was a crazy study done in Detroit, Michigan, like 50 or 60 years ago, I think it was, by a doctor who was studying prostate cancer. And he had a hunch that this was far more prevalent than we thought. And it just wasn't actually killing many people, but lots of people were symptomatic. So he went to all the morgues in Detroit, which was a big city, well, still is a big city, but was a big city then too. And he said, anytime any male dies, if you can release the body, for whatever reason they pass away, I want to see the body. And so he studied all these men who had died of all kinds of different reasons. And what he found was really amazing. He found prostate cancer all over the place. And the proportions were very close to, and it still holds to this day, 20% of 20-year-old males had prostate cancer. 40% of 40-year-old males had prostate cancer. 80% of 80-year-old males. Like, it was a direct correlation. So it is directly correlated with age. There are different kinds, and most of them are benign. My father and my grandfather both got diagnosed with prostate cancer ages ago. But it's been benign. It hasn't affected them tremendously. There are some rare types that can be terminal and act like other cancers, but everybody's going to get it at some point, and you need to get checked up so it's monitored, because we don't know when that is going to turn into the bad kind and spread. Okay, so that's the first one. The next one, testicular cancer. So this is more important for you. You sitting in this room, if you are a male with testicles, are more likely to get this than I am. You are at a far higher risk. Can anybody guess why testicular cancer is a much higher risk for individuals who are 12 to 25? As opposed to me, I'm like clear. It's not gonna, I'm probably not going to get it now. Anybody want to guess? What's going on in male lives these days? What are the testicles up to? What are they doing? You guys are bags of raging hormones right now. Where does testosterone come from? Connect the dots. Where does testosterone come from? The testicles. They are so busy right now, right? And cancer frequently has a higher rate in tissues that reproduce themselves, where there's lots of cellular reproduction. What are the two types of cellular reproduction again? Mitosis and meiosis. There you go. School's good for something. So that is happening a lot in the testicles. And so they are very, very conducive to an area where cancer might start. And so you guys are more likely to get it at your age. So there's the testicle, and that is what a tumor can look like, right? So the blood vessels are coming down. You've got the vas deferens, which is the tube that's going to connect with the urethra where the sperm goes. The big white part is kind of the engine room. It's where all the testosterone is being produced and where the sperm start to get grown. And then the epididymis, the big blue kind of horn there, is where all the sperm gets stored. So frequently, the cancer starts in the area where the cells are reproducing, on the white part there. And so a tumor is actually really, really hard. So a testicle feels like if you were going to pick up a wet pine cone off the ground, right? A wet pine cone, not the crunchy kind that crumple in your hand, but like a wet soaked pine cone. It's a little bit firm, you press on it, that's a testicle. Now imagine there's a pebble in the middle of that, and you feel like a rock on the top. It would really stand out. So that's kind of what that would feel like. So most common in young men, okay? Highly treatable. I teach a course with a doctor who is involved in male reproductive health. And he always jokes, testicular cancer is the best kind of cancer. Why? Why do you think that is? Why do you think testicular cancer is the best to get? Yes?
Well, because you can feel it early on. You can detect it.
Well, there is that. It's easy to detect, and it's highly treatable if we find it early. High success rate. But the other reason is, you got two. You can lose one, and you can still function normally. So that's a very, very good thing.
Everyone grab a ball and let us play.
Does that feel weird to y'all?
It's not even regular size.
That is a huge ball.
Oh, what is this? Have a lump?
They gotta test all the balls.
Tell me if that's normal.
Know your balls. Testicular cancer is 99% beatable when detected early. Tag 3 guys you know and stop testicular cancer.
Okay, so know them, get into a regular rhythm of giving yourself a self-exam. It's not unlike the self-exam that women need to do to detect breast cancer. This is an issue for men, and it needs to be monitored by men. I'd like to introduce Mr. Jones. He has a great deal of personal experience with this issue. Mr. Jones.
I'm not sure I need a clap for checking my balls, but there we go. Is that all right for grade 9? I'm not sure. I've been told what I can say and what I can't say. I might go off script, and if I do, I apologise, and I'll get in trouble, but that's okay. I'm just going to try and talk a little bit about my experience and what happened to me. I was living in the UK. It was my first year as a teacher, and I was in a little place called the Isles of Scilly. And I was in the shower, and I was having a wash, and I checked myself, and I was not sure a little bit unsure, a little bit worried. Couldn't feel it, like if you go back to, can you go back to that? Yeah. Oh, if you can't, don't worry.
Yeah, no, it's okay.
It wasn't, for me, it wasn't as obvious as a massive lump, but it was a little lump, and it was something I wasn't happy with. So probably part of that, the hardest part is actually going to the doctor, because what you have to do, what did I have to do? I had a male doctor. I've got to walk in there, I've got to drop my, I was in shorts obviously, I've got to drop my shorts, I've got to stand there like this while he plays with my balls, you know? It's not easy, that's one of the hardest things, but it's better than the other thing, right? Than not doing anything about it, right? So that was the first thing that I found challenging, and he was like, I'm not sure, Jonesy, there might be something, but I'm not sure. I said, can we just, So I ended up sending me for an ultrasound. So I was trying to, I'm 22-year-old male. I'm like, I'll be sweet, I'll be okay. So I didn't really say much. So where I was living, I had to fly to the mainland because I was on a little island. I had to fly to the mainland. I had to get ultrasounds. I'm on my own. I'd gone on my own. Probably shouldn't have done that. If you're in this situation, please talk to someone. Talk to your family, your brother, sister, best mate, whatever. So I was sitting in a hospital room. Then I got bit of ultrasound, you know, just like when you're pregnant, ladies, it goes on your tummy. No, this was all over my balls. Yeah, and then the doctor comes out and says, look, you got cancer. And you hear the C word and you're like, oh, okay. This is a bit, but you know, they said, look, we've got it early, it's 99%, 95%, whatever, treatable. So I'm like, okay, what's the next plan? It's a bit disappointed. I'd organised a ski trip for the school for the half-term break. I had to cancel that. So I ended up going home, back to Cardiff, because there's a really good hospital there for cancer and stuff. So the next stage for me was they booked me in, I think a week later, and I had to go and have an operation and get my testicle go in for the chop. Very interesting. Hospitals are great places, but they're also a little bit interesting. And next, probably embarrassing moment, if ever you've seen, you know, you watch, what are these medical documentaries, or anyway, these medical shows, House or whatever they are, and they've got a doctor in a white jacket and they've got all these interns. Have you seen that? You know, they've got about 5 of these interns following the doctor around, and seeing these people. They're like, I'm lying there, and they're like, Mr. Jones, can we just, yeah, can you, yeah. So I'm just lying there on the bed, and there's about 5 people all looking at me going, oh yes. Yeah, and I'm just like, thanks, great. But, you know, they all came in, they had a look, prepped me up, and then, I went in for the operation, which was pretty quick. They think they got most of it, but then they wanted to treat me for a course of chemotherapy. My situation was, it's very treatable, but it's treatable because they know exactly what they're dealing with, and they hammer you. So I still got all the scars on my arm from you get this little machine that beeps, and I was in hospital for, my cycle was a week, so I'm in hospital for a week, and I'm holding on to this machine, and it just beeps every couple of hours, and you get a big bag of chemo, which they chuck on, 8 hours it was, and then they put a load of saline solution through afterwards, like salt water, just to flush your system, and then they keep redoing the process. So I was in hospital for a week. Every time I needed to go for a wee, I had to measure how much it was and how much liquid was coming in, and I was in hospital for a week. You lose your hair and all that kind of carry on. I was about a bit bigger than I am now, and I was thinking, yes, I've seen people who've got cancer. They don't look very well. They lose a bit of weight. This could be a win. But they gave me steroid injections to stop me from being sick. So I ballooned up to about 120 kgs, unfortunately. But that was, so a week in, and then they hammer you. Then I go home for a week, and that's when my white blood cells would drop, and I would be struggling, and I had to stay away from people. I couldn't catch colds, and because I was immune to a lot of things. And then I'd go in for another day appointment and get hammered again. And that was probably the worst one, because I'd always come home feeling like I had the flu, and I'd be in bed shivering, and that was the hard nosebleeds, and it was that was tough. But I did three rounds of that, so it was a week on, full on, a week at home, go back in, have another day, come home, another week at home, and then go back in and start the whole cycle again. So that was my chemo, and I did 3 rounds of that. At the time I was in hospital, I was reading Lance Armstrong had put his book out. He was doing the same thing, and it was quite good for me to have someone that I was looking at and seeing what happened with him. I've really just talked a bit of stuff, but the key thing was diagnosis and making sure, I want to re-emphasize, boys, when you're going to have a shower tonight, boys, go check yourself. And every night, just go check yourself and just make sure you're happy. It might seem a bit weird, but it's so important. You get it early, it's not a problem. You get it late, then it can cause cause a problem. So get in and get checked, make sure you're comfortable. If you're not sure, go and ask. The doctors have done it 1,000 times. It's not the end of the world. For us, it's like a massive deal. But for them, it's not a problem. That was probably, finished that, went back to work, sneaked in the last couple of weeks of term, just so I could get paid over the holidays. That was my thing. And then I decided it was time to go and do something with my life. So that's why I moved to New Zealand. That's why I'm here. But that's me. I don't know if there's any question. No, I've got time. Time's up.
Time's up.
Thanks, team.
So I do want to point out some cancers can move really quickly. Mr. Jones, when he was telling me about it, the cancer was in the lymphatic system, which is why he probably had to endure a round of chemo or two. Can any of my students tell me what, if cancer starts in an origin and then spreads to the lymphatic system, what stage of cancer that probably is? 3. 4 is when it's in another organ, but 3. 3 for a lot of cancers is kind of late. So he's quite lucky still. Okay, and the reason we want you checking now is you need to establish a baseline. You should know what normal feels like so that later, if you feel something, you're going to know that that's abnormal. Okay. I just want to reiterate this from last week, right? Part of this is like the man box. We got to get over some of the very old stereotypes of what it is to be a man in order to embrace some of these challenges that we're facing, which includes just like go in and get checked, because if you don't get checked, the alternative, as he mentioned, is death, and that's not as good. Okay, so men's mental health. Male tech depression has externalized symptoms. Typically, depression is like quiet, sad, morose, don't want to get out of bed. But typically in males, it's different. And this is one of those rare cases where we understand less about male health than women's health. Male depression often manifests as symptoms more like anger, as symptoms a lot more like externalized behaviors, okay? So this is a really hard thing to catch for some males because people also often write it off as, oh, typical male behavior. So typical symptoms of depression also very closely mirror indicators for risk factors for suicide. So these are really, really hard things to try and keep an eye out for, but they're both going to be the triggers that we need to watch out for. Sorry, I'm aware of time, so I'm just trying to take the most important bits out of this. And if these go undetected, which they frequently do, this is one of the reasons it can lead to higher rates. But it's also about internalizing the patient themselves feeling shame about discussing some of these topics. So suicide involves a dynamic interplay between 6 to 10 risk factors. And these often involve both physical and mental health. And they're at a time for a lot of males when they're younger, which involves constantly changing physiology of the brain and the body. And this is a really, really difficult thing to try and tackle and recognize. Suicide, though, I want to understand too, is not a choice. It's not a reflection of character or identity. It's a complex pathway for managing real and valid pain and suffering. So these risk factors mirror depression. There are also some things too about different cultures and different professions. So men who experience social stigma and marginalization or trauma, abuse and violence, these typically happen more frequently in indigenous men's, individual in sexual and gender minorities, racialized groups. They are at higher risk. And also occupations, sorry. So military, police, fire. My brother's a firefighter in Edmonton. He has dealt with this with some of his colleagues. When you are constantly involved in traumatic events, it starts to wear on you. And if you don't have the coping mechanisms and recognize you need to speak to somebody about it, you're at much higher risk. Then there's also this thing that we've talked about, alluded to a few times, stoicism. I can deal with it, right? Like even Mr. Jones was talking about like, yep, just buck up, tough up. Here's a Kleenex, carry on, like just get on with things. That is exactly what leads to this problem. So if these exist inflexibly, and to the exclusion of other healthy ideals, they can really impact our health in a really, really negative way. So that leads to higher rates of anxiety, depression, right? If you're internalizing all of this stuff, how does it look on the outside? Psychological stress, maladaptive coping patterns, right? What are some maladaptive coping patterns we've talked about already? Substance abuse, that's a huge one. That's a form of escape, right? Every time somebody uses a substance, they're returning to a very stable, reliable, repeatable state. They know how they're gonna feel. That's a safe place for them to be in that moment. And it's a lot better than the depression and anxiety they might be experiencing. Which is also one of the reasons now that marijuana use is being put into the public and now is being medically studied, now that we know it's actually far more addictive than we previously thought, and especially in people at risk of higher depression. So even though it's a complex issue, by creating safe and honest spaces where vulnerable conversations can happen, that itself is a form of prevention. Knowing that you have people you can go and talk to, places you can go and talk about these things. So it's not just about the person who might be experiencing the depression. We all need to be men of more words, not men of fewer words. We don't need to be stoic. We need to reach out and we need to break through those barriers and have those conversations. And it can be really hard because sometimes we don't take each other seriously. In fact, most of the conversation I hear in the hallway, it's like, if it's not funny, it's not worth saying. But we need to have those serious conversations more often. So emotions are something that well up inside of us, often in a way that is not controllable. Feelings are when we think about those emotions and we actually try and become conscious of describing what they are. So emotions are like instinctual. They're the things that arise in us without our own conscious control. But we have a way we can take conscious control of how those emotions manifest as feelings and behaviors. So in order to get good at that, though, you need to do it more often, and you need to recognize those emotions and talk about them more often. Okay? They are the underlying cause of a lot of mental health issues, but we can take control of those by talking about them. So don't feel, right? That's the message that we often get. Boys don't cry, right? Real men don't cry. Or things like, you know, you're trying to talk about an emotion and maybe have a serious conversation and somebody's like, ugh, whatever, things will get better. Or you try and solve the problem instead of trying to ask questions and actively listen to what they're talking about. So what gets in the way of feeling those emotions? Lack of practice, feeling numb and distracted, unwilling to engage in it in the first place, and you need somebody to step in and help you with that. Being unsure of how to handle them, that takes practice. And a lack of safe places to go or people to talk to. So we need all of our feelings. We need to become engaged with those feelings, and we need to make sure that we understand the importance of doing so. Some of the ways that we can use to deal with emotions often involve some sort of creativity. So that can be artistic expression, but it can also be sports, which is kind of weird. When you are physical, you are being creative with your body, right? You are thinking about how to make a play, right? Like, how can you get around this defender? How can you make it to the hoop? Those are all expressions of creativity in a very physical way. So they serve the same purpose, but taking that time to find that space where you can be creative, either physically or mentally, artistically, that's really important with coping with a lot of these emotions. We're gonna have a number of these supports and resources available during the booths tomorrow. So please stop by and take a look. And of course, anytime you need to, you can always speak to somebody in your family doctor, or one of the amazing counselors we have here at the school. Sorry for keeping you over time. It's really hard to try and say that anything here is less important than anything else, but talk is the big message here. So you're gonna go out of here and you're gonna talk to each other, males and females, right? It doesn't always have to be between bros. But boys, you're also gonna go away and get familiar with your bits so that you can recognize any changes, all right? Thank you so much.
So thank you very much, Mr. Emile, for that presentation, and also just a shout out to Jonesy for sharing something that's really personal for him, but there's such an important message, and I think for the community in general as well. I know that it was a men's health focus, but there's probably a lot today in that presentation as well to do with the mental health that's relevant for everyone here. And I think that if we are strong communities and people go on and move into different relationships, whether you're male, whether you're female, whichever role you're playing, a greater understanding of some of these elements can also help you play a more supportive role in those relationships as that develops as well. So, you know, that's why we're all together. It's not that we haven't just brought the male identifying students into the chapel for this presentation, but we've done it as a community so that we are actually stronger together and you can support each other as well as possible as you move forward. So just a little round of applause for Jonesy. Thank you so much for that. We didn't have these kinds of presentations when I was at school, and I'm really grateful that we do today for you. I think it will help. Thank you. Have a great day.